In recent weeks, Dr. Anthony Fauci has become a staple of President Donald Trump's daily press briefings about COVID-19. A longtime federal employee, Fauci has experience in these tense situations. In the 1980s, he was the face of the federal response to the AIDS crisis. Many commentators have pointed to Fauci's experience in that crisis as crucial for how the United States will be able to handle the novel coronavirus. Fauci graduated from Cornell Medical College just as the nation was escalating its presence in Vietnam. He had to perform some form of military service. He listed the U.S. Public Health Service as his first choice, ending up at the National Institutes of Health. That's where he's been ever since. In 1972, Fauci began as a senior researcher at the National Institute of Allergy and Infectious Diseases. He initially studied the molecular nature of fever and later discovered ways to use low-dose cancer drugs to help patients with overactive immune systems. After nearly a decade at the National Institute of Allergy and Infectious Diseases, Fauci found himself faced with a new threat to the human immune system. In 1981, the New York Times reported that a rare cancer was inflicting some gay men. Fauci felt as though he had been training for a threat like this his whole life. "I wanted to be where the action was," he later remembered. In late 1981, Fauci tried to sound the alarm on what became the AIDS crisis. He wrote a paper on how the disease demanded a medical solution. After being rejected from the New England Journal of Medicine, which accused Fauci of being alarmist, he sent the manuscript to the Annals of Internal Medicine, where the paper was published in June 1982. In the laboratory, Fauci made progress on understanding the new disease. 1983, before it was called HIV, Fauci's lab reported that B cells, which help in the production of antibodies, became hyperactive in patients with AIDS. This helped him understand the ways HIV hijacked B cells and how the antibody system then became erratic. By the late 1980s, when he had become the director of the National Institute of Allergy and Infectious Diseases, Fauci was the nation's leading scientific expert on the AIDS epidemic. In his role as director, he appeared almost daily to discuss the crisis with the media. Fauci, in turn, became the face of the lackluster federal response under the Reagan administration. Specifically, he came under constant questioning about why the government wasn't doing more to help patients with HIV/AIDS. On October 11, 1988, AIDS activists protested outside the Food and Drug Administration. Fauci watched from his window as activists surrounded the building. The rage was not only palpable but justified. The federal government wasn't doing enough. Banners with the words "NIH wake up" and "Stop killing us" were unfurled. Chants of "Fuck you, Fauci" could be heard from the crowd. Yet Fauci had already started to listen to what AIDS activists had to say. He reversed his cautious approach to the crisis and became a public health activist. There were still confrontations between the NIH and AIDS activists, but Fauci wanted to have a more inclusive approach to treatment. Contrary to what had been done before, he supported Parallel Tract, a program that made unapproved AIDS drugs available as soon as they were demonstrated to be safe. Larry Kramer, the author, AIDS activist, and one-time critic of Fauci, more recently called the doctor the only true and great hero in the federal response to the AIDS epidemic. Fauci's experience with HIV/AIDS in the 1980s and 1990s has garnered praise from multiple presidents and earned him a Presidential Medal of Freedom. In this current moment, the 79-year-old doctor from Brooklyn has offered many a comforting presence, at least temporarily even earning the trust of the Trump administration. This is likely due to keeping with what he called his favorite book of philosophy, The Godfather. When confronted by someone who disagrees with him, Fauci says that nothing is personal, that it's strictly business. This might be the right approach to take with a president who has used the same tactic throughout his own career.